compassionate space. Breathe deeply and know you're not alone. Today we're talking about hormonal acne, those frustrating breakouts that seem to appear on a schedule, often resistant to typical treatments. Let's explore how to manage hormonal acne gently and effectively. Hormonal acne is deeply connected to your body's internal rhythms and cycles. It typically appears along your jawline, chin, and lower cheeks, though it can occur anywhere. For many people, it flares predictably before menstruation, during ovulation, during pregnancy, or during other hormonal shifts. Understanding this connection helps you approach it with patience rather than frustration. Hormones, particularly androgens like testosterone, influence sebum production. When these hormones fluctuate or increase, your oil glands produce more sebum, leading to clogged pores and breakouts. This is why hormonal acne often begins or worsens during puberty, pregnancy, menstrual cycles, perimenopause, or when starting or stopping hormonal birth control. The gentle approach to hormonal acne combines appropriate topical care with lifestyle support and, when necessary, internal treatments. Because hormonal acne is driven by internal factors, topical treatments alone often aren't sufficient, but they're still an important part of management. For topical care, establish a gentle routine with proven acne-fighting ingredients. Cleanse once daily with a gentle cleanser, preferably one containing salicylic acid to help keep pores clear. In the morning, rinse with water or use a very light cleanse. Use topical retinoids, which are particularly effective for hormonal acne. Over-the-counter adapalene or prescription tretinoin increase cell turnover, preventing pores from clogging and reducing inflammation. Start with 2 to 3 applications per week and gradually increase as tolerated. Always use sunscreen the next day. Benzoyl peroxide spot treatments can help with active breakouts by killing bacteria and reducing inflammation. Use 2.5% concentration to minimize irritation. Niacinamide is beautifully supportive for hormonal acne. It helps regulate oil production, reduces inflammation, and supports barrier function. A serum or moisturizer with 5% niacinamide can be used twice daily. Azelaic acid addresses both active acne and post-inflammatory marks. It's gentle enough for daily use and works well for hormonal patterns. Always moisturize, even with oily, acne-prone skin. Use lightweight, non-comedogenic formulas. Well-hydrated skin with a healthy barrier responds better to treatment. Sun protection is essential, especially when using retinoids or other sensitizing treatments. Choose oil-free, non-comedogenic sunscreen. Now let's discuss internal approaches to hormonal acne. Since hormonal acne is driven by internal hormone fluctuations, addressing the internal aspect is often necessary for significant improvement. For those who menstruate, certain oral contraceptives can help regulate hormones and reduce acne. Pills containing estrogen and specific progestins, like drospirenone, are FDA approved for acne treatment. Discuss this option with your healthcare provider if it's appropriate for you. Spironolactone is a medication that blocks androgen receptors, reducing the hormonal trigger for acne. It's particularly effective for adult women with hormonal acne. Discuss with a dermatologist whether this might be appropriate for you. It requires monitoring and isn't suitable for everyone, but for many people, it's genuinely life-changing. For severe hormonal acne not responding to other treatments, isotretinoin, Accutane, may be considered. This powerful medication requires careful monitoring and has significant side effects, but it can provide lasting improvement for severe cases. Lifestyle factors significantly influence hormonal balance and thus hormonal acne. Manage stress, which increases cortisol and can worsen hormonal imbalances. Practice stress reduction techniques daily. Meditation, deep breathing, yoga, time in nature, creative expression, or whatever genuinely calms you. Sleep adequately. Sleep deprivation disrupts hormonal balance and increases stress hormones. Aim for 7-9 hours nightly with consistent sleep times. Exercise regularly but not excessively. Moderate exercise helps regulate hormones and reduce stress. However, excessive intense exercise can actually worsen hormonal imbalance in some people. Eat a balanced anti-inflammatory diet. Some research suggests that high glycemic foods and dairy may worsen hormonal acne for some people. Consider trying a lower glycemic diet or eliminating dairy for 6 to 8 weeks to see if it helps. Include foods that support hormone balance, omega-3 rich fish, fiber for helping eliminate excess hormones, antioxidant-rich vegetables and fruits, and adequate protein. Stay well hydrated. Water supports all bodily functions, including hormone regulation and skin health. Consider supplements that may support hormonal balance, though always consult a healthcare provider first. Some people find benefit from omega-3 fatty acids, zinc, evening primrose oil, or DEAM, dindolylmethane. However, supplements aren't regulated as strictly as medications, and effectiveness varies. Track your cycle and your breakouts. If you menstruate, note when in your cycle breakouts occur. This pattern helps you understand your hormonal acne and can guide treatment timing. Some people intensify topical treatments during their high breakout phase of their cycle. Be especially gentle during hormonal flare periods. Your skin is more reactive and sensitive during these times. Avoid introducing new products or harsh treatments right before or during your period. Limit dairy consumption. While the connection isn't proven for everyone, many people find their hormonal acne improves when they reduce or eliminate dairy, particularly milk. The hormones naturally present in dairy may contribute to breakouts in susceptible individuals. Avoid touching your face, which transfers bacteria and oil. This is especially important during hormonal breakout periods when your skin is more vulnerable. Keep everything that touches your face clean: pillowcases, phone, makeup brushes. Change pillowcases every 2 to 3 days during active breakouts. Don't pick at hormonal acne. Deep hormonal breakouts are particularly prone to scarring when picked. Keep your hands away no matter how tempting. Be patient with treatment. Hormonal acne often takes longer to respond to treatment than other types. Expect 3 to 6 months before seeing significant improvement. Hormonal treatments in particular take time to regulate hormone levels and show effects on your skin. Understand that hormonal acne may not be completely curable, but it's highly manageable. Even with good treatment, you may have some breakouts during hormonal fluctuations. The goal is significant improvement, not perfection. For severe or persistent hormonal acne, work with a dermatologist. They can prescribe stronger topical treatments, recommend hormonal therapies, or discuss systemic options. Professional guidance is valuable for stubborn hormonal acne. Remember that hormonal acne is not your fault. It's not caused by poor hygiene or inadequate skincare. It's your body responding to internal hormonal signals. Treat yourself with compassion, not judgment. As we close, remember, hormonal acne requires patience, comprehensive care addressing both external and internal factors, and self-compassion. With appropriate treatment and lifestyle support, significant improvement is possible. May your hormones find balance. May your skin clear. Welcome to this peaceful moment. Breathe and relax. Today we're comparing sheet masks and wash-off masks, two popular mask formats that work differently and serve different purposes in your skincare routine. Both sheet masks and wash-off masks can be valuable additions to your skincare, but understanding their differences helps you choose which type suits your needs, lifestyle, and preferences better. Let's explore each type in depth, comparing their benefits, limitations, and ideal uses. Understanding sheet masks. Sheet masks are fabric or fiber sheets, often cotton, hydrogel, or biocellulose, pre-soaked in serum or essence, cut to fit your face with openings for eyes, nose, and mouth. The concept is simple. The sheet acts as a delivery system, keeping serum in contact with your skin for extended time without evaporation. This allows ingredients to penetrate more effectively than if you simply applied serum and let it dry. Sheet masks originated in Asia, particularly Korea and Japan, where they've been popular for decades. They've now become mainstream worldwide due to their convenience and effectiveness. Sheet mask benefits. Convenience is perhaps the biggest advantage. Sheet masks are pre-measured, pre-mixed, and ready to use. No mixing, no mess, no measuring ingredients. You simply unfold and apply. They're travel-friendly. Individual packets are lightweight and spill-proof, perfect for bringing on trips. Hotels, airplanes, anywhere, sheet masks work. The application is foolproof. Unlike wash-off masks where you might apply unevenly or use too much or too little, sheet masks deliver a consistent amount of product evenly across your face. Hygiene is better with sheet masks. Each mask is individually sealed, reducing contamination risk. With wash-off masks in jars, you dip fingers in repeatedly, potentially introducing bacteria. Sheet masks stay moist throughout wear time. The sheet prevents product from drying out, maintaining its effectiveness for the full 15-20 minutes. They're generally gentle and suitable for most skin types. The majority focus on hydration, brightening, or soothing, rarely on harsh treatments. There's incredible variety. You can find sheet masks for every concern: hydration, anti-aging, brightening, calming, pore care, firming. Different brands offer different serum formulations. They provide forced relaxation time. When wearing a sheet mask, you're somewhat immobilized, encouraging you to lie down and rest. This relaxation itself benefits your skin through stress reduction. Sheet mask limitations. Cost per use is often higher than wash-off masks. A single sheet mask might cost $2 to $10 or more, while a jar of wash-off mask provides multiple applications for a similar price. Environmental waste is a concern. Each sheet mask creates packaging waste. The packet, the sheet itself, often a secondary protective layer. This isn't eco-friendly, though some brands now offer biodegradable or compostable options. One size fits all doesn't fit all faces. Sheet masks are designed for average face shapes and sizes. If your face is particularly small or large, or your features are positioned differently, the mask might not fit well, leaving gaps or hanging loosely. You can't multitask easily while wearing a sheet mask. The sheet is delicate and can slip or tear if you move around too much. You're essentially confined to lying or sitting still. You can't customize the treatment area. If you only want to treat your T-zone or your cheeks, tough luck. The sheet covers your entire face with the same treatment. Some sheet masks contain problematic ingredients. Quality varies enormously. Cheap sheet masks might contain alcohol, fragrance, or other irritants. Always check ingredients. The serum absorption isn't always complete. You might have leftover serum on your face that needs patting in, and your skin might not absorb it all if it's too much product. Understanding wash-off masks. Wash-off masks are creamy, gel, or clay formulations applied to skin and rinsed off after a specified time. They come in jars, tubes, or squeeze bottles. This traditional mask format has been used for centuries in various forms. Modern formulations are sophisticated, targeting numerous concerns with specialized ingredients. Wash-off mask benefits. Cost effectiveness is significant. One jar might provide 10 to 30 applications depending on size and how generously you apply. The per-use cost is usually lower than sheet masks. Customization is possible. You can apply different masks to different facial areas. Clay on your oily T-zone, hydrating mask on dry cheeks. This multi-masking approach addresses multiple concerns simultaneously. You control the amount. Apply a thin layer or a thick layer depending on your needs and preferences. You decide what works for you. More treatment variety exists in wash-off format. Clay masks, mud masks, exfoliating masks, warming masks, bubbling masks. Many specialized treatments only work in wash-off format. More potent treatments are possible. Clay masks that deeply cleanse, exfoliating masks with active acids, purifying masks with charcoal. These intensive treatments work best as wash-offs. Less packaging waste per use makes them more environmentally friendly. One jar replaces dozens of individual sheet mask packets. You have more flexibility during wear time. While you should still relax, you can move around more than when wearing a delicate sheet. You could do light chores, though resting is still ideal. Wash-off mask. Limitations. Application requires more effort. You must scoop product, apply evenly, avoid eye and lip areas carefully, and ensure you haven't missed spots. It's messier. Cleanup is necessary. You need to rinse thoroughly, often with a washcloth, and clean your sink afterward. It's not as neat as peeling off a sheet. Product can dry out between uses, especially jars where air exposure is constant. Tubes are better sealed but still face some degradation over time. Measuring appropriate amounts takes practice. Too little and you don't get full benefits. Too much wastes product and takes forever to rinse off. Hygiene requires attention. Dipping fingers into jars repeatedly can introduce bacteria. Using a clean spatula helps but is an extra step. Travel is less convenient. Jars or tubes are heavier and bulkier than sheet mask packets. Spillage is possible if not packed carefully. Choosing based on skin type and concerns. For oily or acne-prone skin, wash-off clay or mud masks work exceptionally well for deep cleansing and oil control. Sheet masks work too, focusing on hydration and oil balance without adding excess oil. For dry skin, both types can be excellent for hydration. Hydrating wash-off cream masks and hydrating sheet masks both deliver intensive moisture. Choose based on convenience preference. For sensitive skin, gentle sheet masks with minimal ingredients are often safer, though gentle wash-off gel or cream masks work too. Avoid clay masks, which can be too drying and potentially irritating. For combination skin, wash-off masks offer the advantage of multi-masking, using different treatments on different zones. Sheet masks treat your whole face uniformly. For anti-aging concerns, both formats work. Look for ingredients like retinol, peptides, antioxidants, and hyaluronic acid regardless of format. For brightening, both can deliver vitamin C, niacinamide, and other brightening ingredients effectively. Choose based on preference and lifestyle. Choosing based on lifestyle. If you travel frequently, sheet masks win for convenience and portability. If environmental concerns are important, wash-off masks generate less waste. If you're always rushed, sheet masks require less active effort, though both take similar time overall. If you enjoy spa-like pampering rituals, wash-off masks might feel more luxurious with their creamy application and warm water rinsing. If you want absolute simplicity, sheet masks are easier. No judgment on application skill needed. Using both strategically. Many people successfully incorporate both types into their routines, using each when it makes most sense. Use sheet masks when traveling, when you want quick convenience for gentle daily or frequent masking, when you want to relax completely without moving. Use wash-off masks when deep cleansing is needed, when you want to multi-mask different areas for more intensive treatments, when cost per use matters. This flexible approach lets you enjoy benefits of both formats. Quality matters more than format. Regardless of which format you choose, ingredient quality matters most. A terrible sheet mask with cheap ingredients won't outperform a quality wash-off mask, and vice versa. Read ingredient lists. Look for beneficial actives high on the list. Avoid unnecessary irritants like fragrance if your skin is sensitive. Check reviews from people with similar skin types. Price doesn't always indicate quality. Some affordable options are excellent. Some expensive options are overpriced marketing. Research and trial help you find what works. Making either type work better. For sheet masks, store extras in the refrigerator for cooling, depuffing effect. Press sheet firmly against skin to remove air bubbles. Pat remaining serum into skin. Don't waste it. Consider reusable silicone mask covers that prevent sheet mask evaporation, extending effectiveness. For wash-off masks, use a brush for more even, hygienic application. Apply to damp skin for better spread. Use lukewarm water for rinsing. Too hot is drying. Pat skin gently dry and immediately follow with moisturizer. Both types benefit from proper timing. Follow product instructions. Don't leave on longer, hoping for better results. This often backfires with irritation or dryness. As we close, remember there's no universally superior format. Sheet masks and wash-off masks both have places in skincare. Your choice depends on your skin's needs, your lifestyle, your values, and your preferences. Some people strongly prefer one over the other. Others happily use both. Either approach is valid if it works for you and your skin responds well. What matters is choosing quality products with good ingredients, using them appropriately and consistently, and enjoying the self-care ritual of masking. Take a deep breath in and out. You now understand the differences between sheet masks and wash-off masks and can choose wisely. May you find mask formats that fit your life and serve your skin beautifully. May your masking ritual bring peace and visible benefits. Thank you for this time together. Mask with knowledge, choose with confidence, and enjoy your self-care. Welcome and breathe deeply. Today we're exploring facial oils, a category of skincare that confuses many people, especially those with oily skin who think oils are the enemy. Let's clear up misconceptions and understand how oils can benefit virtually every skin type. Facial oils have been used in skincare for millennia across many cultures. Recently, they've experienced a renaissance in modern skincare as people rediscover their benefits and versatility. The key to understanding facial oils is recognizing that not all oils are the same. Different oils have different properties, different weights, different benefits. The right oil used correctly can transform your skin. The wrong oil used inappropriately can cause problems. Understanding oil in your skin. Your skin naturally produces oil, sebum, from sebaceous glands. This natural oil serves important purposes: moisturizing your skin, protecting your skin barrier, providing antibacterial properties, and keeping your skin supple. When we talk about facial oils in skincare, we're discussing plant-based oils that can supplement, regulate, or support your skin's natural oil production and barrier function. Here's something counterintuitive. Applying certain oils to your skin can actually help regulate excessive oil production. When your skin is stripped of oil by harsh cleansers, it compensates by producing more oil. When you provide appropriate oils, your skin can normalize its own production. This is why even oily skin can benefit from the right facial oils used correctly. Types of facial oils. Facial oils fall into several categories based on their molecular weight and how they interact with skin. Dry oils are lightweight oils that absorb quickly without leaving greasy residue. Examples include squalane, jojoba oil, rosehip oil, and argan oil. These work well for most skin types, including combination and slightly oily skin. Heavy oils are richer and more occlusive. Examples include coconut oil, olive oil, and avocado oil. These are excellent for very dry skin, but can clog pores on acne-prone or oily skin. Essential oils are concentrated plant extracts with strong scents and properties. They should be used with extreme caution. Most are too potent to apply undiluted, and many are irritating. We'll focus primarily on carrier oils rather than essential oils. Benefits of facial oils. Facial oils provide intense hydration by preventing water loss from your skin. While oils don't add water to your skin, only humectants do that, they seal in moisture, preventing transepidermal water loss. They strengthen your skin barrier by providing lipids that are part of your skin's natural barrier structure. A healthy barrier means more resilient, comfortable skin. Many facial oils contain antioxidants that protect against free radical damage from UV exposure and pollution. Vitamin E, found in many oils, is a powerful antioxidant. Oils can improve skin texture by softening rough patches and smoothing the skin surface. Regular use makes skin feel silkier and look more refined. Some oils have anti-inflammatory properties that can calm redness and irritation. Rosehip oil, sea buckthorn oil, and many others help soothe reactive skin. Oils can balance combination skin by hydrating dry areas without overloading oily areas, especially when you use lightweight options. Specific oils and their properties. Jojoba oil closely resembles human sebum in structure. It's lightweight, absorbs well, and suits most skin types. It can help regulate oil production and won't clog pores for most people. Excellent for combination in oily skin. Squalane is derived from olives or sugar cane. It's extremely lightweight, non-comedogenic, and deeply hydrating. It's one of the best all-around facial oils, suitable for nearly everyone, including acne-prone skin. Rosehip oil is rich in vitamins A and C, making it excellent for anti-aging, brightening, and scar healing. It's relatively lightweight and suits most skin types. Great for mature skin or skin with dark spots and scarring. Argan oil is packed with vitamin E and fatty acids. It's moisturizing without being heavy, works for most skin types, and provides antioxidant protection, good for dry to normal skin. Marula oil is lightweight, fast absorbing, and rich in antioxidants. It hydrates without greasiness, suitable for most skin types, particularly good for anti-aging. Sea buckthorn oil is intensely orange and incredibly nutrient-rich. It's excellent for healing damaged, irritated, or inflamed skin. Use sparingly and expect temporary orange tint. Best for distressed skin needing intensive repair. Grapeseed oil is light and slightly astringent, making it good for oily and acne-prone skin. It contains antioxidants and absorbs quickly. Oils to approach with caution. Coconut oil is highly comedogenic for many people, meaning it clogs pores easily. While some people love it, others break out terribly. If you're acne-prone, coconut oil is risky for facial use. Olive oil is heavy and can be pore clogging. It's fine for very dry skin or body use, but many find it too heavy for faces. Essential oils like tea tree, peppermint, eucalyptus, and citrus oils can be irritating. If you use them, dilute properly in a carrier oil and patch test. Never apply undiluted to your face. How to use facial oils. Timing in your routine matters. Oils generally come at the end of your routine because they create a seal that can prevent other products from penetrating. However, some people prefer applying oil before moisturizer, using the moisturizer to seal everything in. The most common order is cleanse, tone, serum, moisturizer, then oil. But you can experiment with what works for your skin. Amount matters. Less is more. A few drops are sufficient for your entire face. 1 to 3 drops warmed between your palms, then press gently into your skin. Don't pour oil directly onto your face. Press. Don't rub vigorously. Use gentle patting and pressing motions to help the oil absorb. Massage lightly if you enjoy facial massage, but aggressive rubbing isn't necessary. You can mix oils into other products. Add a drop or two of facial oil to your moisturizer for extra hydration. Mix with foundation for a dewy finish. Add to body lotion for extra nourishment. Frequency depends on your skin and the oil. Some people use facial oil twice daily, others only at night. Very oily skin might use oil every few days or only on dry patches. Listen to your skin. Facial oils for different skin types. For dry skin, richer oils work beautifully. Argan, rosehip, marula, even the heavier avocado oil. Apply generously morning and night. Your thirsty skin will drink it up. For oily skin, Lightweight, non-comedogenic oils can actually help. Jojoba and squalane are your best bets. Use sparingly. 1 drop might be enough. Apply only at night initially to see how your skin responds. For combination skin, consider applying different oils to different zones, or stick with versatile lightweight options like squalane or jojoba that work for both dry and oily areas. For sensitive or reactive skin, simple, pure oils without added fragrances or ingredients are safest. Squalane, sunflower oil, or safflower oil are generally well tolerated. For mature skin, oils rich in antioxidants and vitamins support aging skin. Rosehip, argan, and sea buckthorn are excellent choices. For acne-prone skin, this requires careful selection. Non-comedogenic oils like squalane, grapeseed, or hemp seed oil are least likely to cause breakouts. Start with tiny amounts and watch your skin's response carefully. Common mistakes with facial oils. Using too much is the most common error. Oils are concentrated. You need very little. Excess oil sits on your skin feeling greasy without providing additional benefit. Applying oil to dry skin reduces effectiveness. Apply oil to damp skin for better absorption, or apply after water-based serums and moisturizers. Using the wrong oil for your skin type causes problems. Heavy oils on oily skin lead to breakouts. This doesn't mean oils are bad. It means you chose the wrong one. Expecting instant miracles leads to disappointment. Oils provide real benefits but require consistent use over weeks to see significant improvement. Not patch testing. New oils can result in reactions or breakouts. Test new oils on a small area first, especially if you're acne-prone or sensitive. Quality matters. Pure cold-pressed oils are generally best. Look for oils in dark glass bottles that protect from light degradation. Check for proper storage recommendations. Organic matters less than you might think, but it's nice if it's affordable. What matters more is purity. No additives, fragrances, or fillers. Price varies widely. Some excellent oils are affordable. Others are pricey, but not necessarily better. Research specific oils and read reviews before investing in expensive options. Oil cleansing method. Some people use oils not just for moisturizing, but for cleansing. The oil cleansing method. The principle is that oil dissolves oil, so using oil cleanser removes sebum and oil-based impurities without stripping skin. If you're interested, this is different from using facial oils for moisturizing. It requires specific cleansing oils or balms formulated to emulsify with water. We covered this in our double cleansing discussion. Storage and shelf life. Store oils in cool, dark places. Light and heat degrade oils faster. Some people refrigerate certain oils to extend shelf life. Most oils last 6 to 12 months after opening if stored properly. Some are more stable, some less. Rancid oil smells off and can irritate skin. Discard if your oil smells strange. As we close, remember that facial oils are tools, not magic potions. Used appropriately, they can significantly enhance your skin's health, comfort, and appearance. Used inappropriately, they can cause problems. Start with one lightweight, versatile oil like squalane or jojoba. Use tiny amounts. Observe your skin's response over several weeks. If it works well, you might explore other oils. If problems arise, adjust your approach or amount. Your skin is unique. What works for others might not work for you, and that's okay. Finding your perfect oil or oil combination takes experimentation and patience. Take a deep breath in and out. You now understand facial oils and how to incorporate them wisely into your routine. May you find oils that nourish your skin beautifully. May you use them with knowledge and confidence. May your skin glow with the healthy radiance that comes from proper care. Thank you for this time together. Oil with wisdom, apply with care, and trust your skin's response.
Many people use ketoconazole shampoo on body areas, lathering and leaving it on for 5 to 10 minutes before rinsing. Ketoconazole is gentle and suitable for frequent use. Zinc pyrithione is another topical antifungal commonly found in anti-dandruff shampoos. At 1 to 2% concentration, applied daily, it reduces malassezia and can improve fungal acne. Like ketoconazole, it's gentle and suitable for long-term use. Selenium sulfide is a strong topical antifungal traditionally used for fungal skin conditions. At 2.5% concentration, available by prescription, applied daily, selenium sulfide effectively treats fungal acne. However, some people find it irritating or have sensitivity, limiting its use in some cases. For extensive fungal acne or fungal acne resistant to topical antifungals, oral antifungals may be necessary. Fluconazole is a systemic antifungal taken orally. Typical dosing for fungal acne is 50 to 100 mg daily for 2 to 4 weeks, or alternatively, 200 mg weekly for several weeks. Oral fluconazole effectively treats extensive fungal acne and reaches areas topical antifungals cannot. However, oral antifungals can have side effects and require more medical supervision than topicals. Itraconazole is another systemic antifungal option, sometimes used as an alternative to fluconazole. Dosing and duration vary based on specific protocols and severity. Additional strategies for fungal acne management include addressing contributing factors. Wear breathable, moisture-wicking clothing. Shower promptly after sweating. Keep skin clean and dry. Use gentle, minimal skin care. Avoid heavy oils and occlusive moisturizers. Live and dry environments when possible or use a dehumidifier. These environmental modifications reduce conditions favoring yeast overgrowth. Niacinamide may provide supplementary benefit for fungal acne, as it has mild antifungal properties and reduces sebum production. Including a niacinamide product in your routine might provide additional benefit alongside topical antifungals. The challenge with fungal acne is that it can recur if contributing factors aren't addressed. If you treat fungal acne successfully but then resume wearing tight synthetic clothing in a humid environment, fungal acne may recur. Long-term management might involve occasional use of topical antifungals, weekly or monthly, to prevent recurrence. If you've been treating acne without improvement for several weeks or months, ask your dermatologist about fungal acne. A simple KOH preparation takes minutes and can confirm or rule out malassezia. Don't waste time on ineffective antibacterial treatments if you have fungal acne. Appropriate antifungal treatment provides rapid improvement. Guide 25, Acne in Different Life Stages, Adolescent, Adult, and Menopausal Acne. Acne presents differently and requires different approaches depending on life stage. Understanding age-specific acne characteristics and treatment approaches ensures appropriate management across different ages. Adolescent acne, occurring during puberty, is the most common form. Hormonal changes during puberty, particularly increased androgens, trigger increased sebum production, making adolescent acne typically more oily and comedone-prone. Adolescent acne often affects the T-zone, forehead, nose, chin, particularly heavily. Peer influence, stress about appearance, and psychological impact are often significant. Most adolescents can manage acne with topical treatments alone, though moderate to severe cases may require oral antibiotics or hormonal treatments, particularly girls. Treatment approach for adolescent acne emphasizes prevention and establishing good habits. Starting with gentle cleansing, topical treatments, and sun protection during teenage years establishes habits that persist into adulthood. Most adolescent acne improves or resolves as hormonal stability is achieved in late teens or early 20s, though some individuals continue experiencing acne into adulthood. Adult acne, occurring in adults beyond teenage years, has different characteristics. Adult acne is often more localized, jawline, chin, lower face, and frequently hormonal in nature, particularly in women. Adult acne is often more inflammatory than comedonal compared to adolescent acne. Stress, hormonal cycles, skincare product irritation, and lifestyle factors play larger roles in adult acne than in adolescent acne. Adult acne is sometimes attributed to skincare products or cosmetics, acne cosmetica. Adult women with acne often benefit from hormonal evaluation and hormonal treatments. Oral contraceptives or spironolactone can provide significant improvement. Additionally, adult women should evaluate whether acne patterns correlate with their menstrual cycle, as this suggests hormonal involvement. Adult male acne is less common than in adolescence but does occur. When it persists into adulthood, it's often quite severe and may warrant aggressive treatment including isotretinoin consideration if not responsive to standard treatments. Occupational factors sometimes contribute to adult acne. Individuals with occupations exposing them to oils, chemicals, or heat, mechanics, cooks, healthcare workers, sometimes experience acne from occupational exposure. In these cases, addressing occupational factors, protective equipment, skin cleansing protocols, helps alongside medical treatment. Menopausal acne occurs in perimenopausal and menopausal women due to hormonal fluctuations. As estrogen levels decline and the ratio of androgens to estrogen increases, acne can develop or worsen. Menopausal acne often presents as deep, cystic lesions on the lower face and chin. Hormone replacement therapy, HRT, during menopause can help manage menopausal acne, though it's a complex decision requiring discussion with your healthcare provider about overall health implications of HRT. If HRT isn't pursued, topical treatments and oral spironolactone are options for menopausal acne. Many menopausal women find that aggressive topical treatment with retinoids and benzoyl peroxide adequately controls acne. Stress management and lifestyle optimization become increasingly important during menopause. Pregnancy acne occurs in some pregnant women due to hormonal changes. Treatment options are limited during pregnancy because many acne medications are contraindicated. Isotretinoin is absolutely contraindicated due to severe teratogenic effects. Retinoids are generally avoided. Oral antibiotics like doxycycline are contraindicated. Spironolactone is contraindicated due to potential effects on male fetus development. Safe treatment options during pregnancy include topical benzoyl peroxide, topical azelaic acid, topical salicylic acid, though large-scale systemic absorption is theoretically possible with large area application, and it's best used sparingly, and possibly topical clindamycin. Most women manage pregnancy acne with these limited options, prioritizing safety. Some pregnant women actually experience improvement in acne due to pregnancy hormonal changes, while others experience worsening. Postpartum acne sometimes occurs as hormones shift again after delivery. This usually resolves within several months, though if breastfeeding is occurring, some hormonal factors may persist. Standard acne treatments are generally safe while breastfeeding, though some medications require careful consideration. Discuss specific medications with your healthcare provider if treating acne while breastfeeding. Age-related changes in acne treatment tolerance are important. Adolescent skin is generally very resilient and tolerates aggressive treatment well. Aging skin becomes more sensitive and drier, requiring gentler treatments and more aggressive moisturizing even if using the same medications. An adolescent might tolerate 2% salicylic acid daily with minimal dryness, while a 45-year-old woman with the same treatment might experience excessive dryness and irritation, necessitating reduced frequency or concentration. Transitional acne between life stages sometimes occurs. A teenager transitioning to adulthood might experience changing acne patterns. An adult woman starting hormonal contraceptive might initially experience worsening acne before.
Welcome to this peaceful space of learning and care. Take a deep breath in, feeling calm, enter your body. Exhale gently, releasing any tension. Today we're going to talk about preventing clogged pores, how to keep your pores clear and healthy through gentle, consistent practices rather than aggressive intervention. Clogged pores are at the root of many skin concerns: blackheads, whiteheads, acne, and rough texture. When pores become blocked with oil, dead skin cells, and debris, problems develop. But here's empowering news. Pore clogging is largely preventable through thoughtful daily habits and a gentle skincare routine. Let's begin by understanding what causes pores to clog. Your pores contain hair follicles and sebaceous glands that produce oil called sebum. This oil is natural and necessary. It protects and moisturizes your skin. Problems arise when too much oil is produced, when dead skin cells accumulate faster than they shed, or when external debris mixes with these and blocks the pore opening. Several factors contribute to clogged pores: excess oil production influenced by hormones, genetics, and stress, dead skin cell buildup from inadequate exfoliation or too rapid cell turnover, heavy or pore clogging skincare and makeup products, inadequate cleansing that leaves residue on your skin, environmental pollutants that settle on your skin, and touching your face frequently, which transfers oil and bacteria. Understanding these causes helps you prevent them systematically. The foundation of pore clogging prevention is proper cleansing. Cleanse your face thoroughly once daily in the evening to remove oil, dead skin cells, makeup, sunscreen, and environmental debris that have accumulated. Use a gentle but effective cleanser appropriate for your skin type. For oily or combination skin prone to clogged pores, a gel cleanser with salicylic acid can be beneficial. Salicylic acid is oil-soluble and penetrates into pores, helping keep them clear. Use 0.5 to 2% concentration. Double cleansing in the evening helps ensure complete removal of all pore-clogging substances. Start with an oil-based cleanser or micellar water to dissolve makeup, sunscreen, and excess sebum. Follow with your regular water-based cleanser to remove any remaining residue. Cleanse thoroughly but gently. Massage your cleanser onto your skin for a full minute, giving it time to work. Pay attention to areas prone to clogging: nose, chin, forehead. Rinse completely with lukewarm water. However, don't over-cleanse. Cleansing more than once daily or using harsh cleansers can strip your skin, triggering more oil production and actually worsening pore clogging. Balance is key. Regular exfoliation prevents dead skin cell buildup that contributes to clogged pores. Chemical exfoliation with AHAs or BHAs is generally more effective and gentler than physical scrubs. Salicylic acid, BHA, is particularly effective for preventing clogged pores because it penetrates into pores and dissolves oil and debris. Use a salicylic acid treatment 2 to 4 times per week, depending on your skin's tolerance. This could be a toner, serum, or leave-on treatment with 0.5 to 2% salicylic acid. AHAs like glycolic or lactic acid exfoliate the skin's surface, preventing dead cell accumulation. These work well for many skin types. Use 5 to 8% concentration 2 to 3 times weekly. Don't use multiple exfoliants at once or exfoliate daily unless your skin clearly tolerates it without irritation. Overexfoliation damages your barrier and can worsen your skin. Choose your skincare and makeup products carefully to avoid introducing pore-clogging ingredients. Look for products labeled non-comedogenic, which means they're formulated not to clog pores. Common pore-clogging ingredients to be cautious of include coconut oil, though some people tolerate it fine, certain silicones in high concentrations, heavy oils and butters, some waxes, and thick, occlusive formulas if you're very oily. However, ingredient sensitivity is individual. A product that clogs one person's pores might be fine for another. Pay attention to your own skin's response rather than universally avoiding ingredients. For pore-prone skin, choose lightweight formulas, gel or gel cream moisturizers rather than heavy creams, fluid or gel sunscreens rather than thick creams, and mineral makeup or lightweight liquid formulas rather than heavy, oil-based makeup. Remove makeup thoroughly every evening. Sleeping in makeup is one of the surest ways to clog your pores. No matter how tired you are, at minimum, remove your makeup with micellar water before sleep. Moisturize consistently, even if you have oily skin. Dehydrated skin can actually trigger more oil production and more pore congestion. Use an appropriate lightweight, non-comedogenic moisturizer that provides hydration without heaviness. Sun protection is essential, but choose your sunscreen wisely for pore-prone skin. Mineral sunscreens with zinc oxide work well for many people prone to clogged pores. Lightweight chemical sunscreens are also available. Find one that doesn't feel heavy or greasy on your skin. Lifestyle habits significantly affect pore health. Don't touch your face unnecessarily throughout the day. Your hands carry oil, dirt, and bacteria that transfer to your skin and contribute to clogged pores. Every touch is an opportunity for contamination. Keep everything that touches your face clean. Change your pillowcase at least twice weekly. Nightly if you're very prone to clogged pores. Use a clean towel to dry your face, or dedicate a small face towel that you wash frequently. Clean your phone screen regularly as it touches your face and harbors bacteria and oil. If you wear makeup, clean your brushes and sponges regularly. weekly at minimum. Dirty application tools harbor bacteria and reintroduce oil and old makeup to your skin, clogging pores. Avoid heavy, pore-clogging hair products near your hairline and face. Pomades, heavy styling creams, and thick conditioners can migrate onto your face, especially along your hairline and forehead, causing clogged pores and breakouts. Use lighter products or keep hair products away from your face area. Manage oil production through lifestyle factors. Stress increases cortisol, which triggers more sebum production. Whatever helps you manage stress, exercise, meditation, adequate sleep, relaxation practices, indirectly helps prevent clogged pores. Stay hydrated by drinking water consistently. When your body is well hydrated, your skin is better able to regulate its own oil and moisture balance. Eat a balanced diet. Some people find that dairy or high glycemic foods increase their oil production and pore clogging. If you suspect a dietary connection, try eliminating these foods for a month and observe whether your skin improves. Consider professional treatments if you're prone to persistent clogged pores, despite good home care. Regular facials with professional extraction by a trained esthetician can help keep pores clear. Professional chemical peels provide deeper exfoliation. Discuss these options with a licensed professional. Retinoids, either over-the-counter or prescription, are highly effective at preventing clogged pores by increasing cell turnover and preventing debris accumulation. If home remedies aren't sufficient, consult a dermatologist about whether retinoids might help. Maintain consistency with your prevention routine. Pores don't clog overnight, and keeping them clear requires daily attention to cleansing and regular exfoliation. The habits you build and maintain matter more than any single product or treatment. Be patient with results. Even with perfect prevention, occasional clogged pores may occur due to hormones, stress, or other factors beyond your control. Don't judge yourself or your routine based on occasional breakouts. Assess your skin over weeks and months, not days. Remember that some degree of visible pores is normal and natural. Pores are real structures in your skin that serve important functions. You're not aiming for invisible pores. That's not realistic or necessary. You're aiming for clear, unclogged pores that function properly. As we close, embrace this truth.
After 1 to 2 weeks of consistent use, inflammatory acne should appear less red and swollen. After 4 weeks, you should see significant improvement in the number of inflammatory lesions. Full results typically appear after 6 to 8 weeks of consistent use. Long-term use of benzoyl peroxide is safe and very common. Many people successfully maintain clear skin for years using benzoyl peroxide as their primary acne treatment. However, some dermatologists recommend occasionally taking breaks from benzoyl peroxide, perhaps 1 week per month, to allow your skin's natural bacteria to repopulate normally. This isn't absolutely necessary, but some people find it helpful in maintaining overall skin health. One important consideration: never use benzoyl peroxide with vitamin C or niacinamide at the same time, as benzoyl peroxide can oxidize these ingredients, reducing their effectiveness. Apply these ingredients in the morning and benzoyl peroxide in the evening, or use them on different days. Guide 6: Retinoids, the Gold Standard Anti-Aging and Acne Treatment Comprehensive Guide. Retinoids represent the gold standard in skincare science, with decades of research supporting their effectiveness for acne, aging, and general skin health. understanding retinoids' mechanism, types, concentrations, and proper use is essential for anyone serious about achieving clear, healthy skin. Retinoids are vitamin A derivatives that work through multiple powerful mechanisms. First, they increase cellular turnover, causing your skin to shed old cells and reveal fresh, new skin underneath. This prevents dead skin cell accumulation that leads to clogged pores and comedones. Second, they normalize sebaceous gland function, helping regulate sebum production. Third, they stimulate collagen production, improving skin elasticity and minimizing fine lines. Fourth, they have anti-inflammatory effects, reducing the redness and irritation of acne. Fifth, they prevent follicular hyperkeratinization, the abnormal cell shedding that contributes to acne. Sixth, they have antioxidant properties, protecting skin from free radical damage. The retinoid family includes various types at different strengths. Over-the-counter retinol is the gentlest form, requiring conversion by your skin's enzymes to the active retinaldehyde and then to retinoic acid. This multi-step conversion process makes retinol gentler but less immediately effective than prescription retinoids. Retinol, retinaldehyde, is slightly more powerful than retinol, requiring one fewer conversion step. Prescription retinoids include tretinoin, Retin-A, adapalene, Differin, and tazarotene, which are already in their active form and thus more powerful and faster-acting than over-the-counter options. For someone new to retinoids, starting with over-the-counter retinol at a low concentration, 0.25 to 0.3%, is typically appropriate. This allows your skin to build tolerance gradually. After several months of consistent retinol use, you might consider asking your dermatologist about prescription retinoids for enhanced results. Retinoids are only used at night because they increase sun sensitivity substantially. UV exposure dramatically increases the risk of photosensitivity reactions and post-inflammatory hyperpigmentation. Morning retinoid use would leave your skin vulnerable to severe sun damage throughout the day. When starting retinoids, begin with a very conservative approach. Use a low-concentration retinol product just 2 to 3 times per week initially. Apply it to completely dry skin, as retinoids irritate damp skin significantly. Wait 20 minutes after cleansing before applying retinoid to ensure your skin is completely dry. Use a pea-sized amount for your entire face. Retinoids are potent and a little goes a long way. During the first 4 to 12 weeks of retinoid use, expect a retinization phase characterized by redness, peeling, flaking, and sometimes temporary worsening of acne. This is normal and doesn't indicate that retinoids aren't appropriate for you. This phase typically lasts 2 to 8 weeks and gradually resolves as your skin adapts. Many people who discontinue retinoids during this phase miss out on their incredible long-term benefits simply because they couldn't tolerate the short-term adjustment period. Managing retinization involves strategic moisturizing. Use your retinoid, then wait about 20 minutes, then apply a hydrating moisturizer over top. Some people layer their moisturizer directly on top of wet retinoid serum, which dilutes the retinoid slightly and reduces irritation. This is called the sandwich method. This method is appropriate when dealing with significant irritation. As your skin adapts, you can gradually stop using the sandwich method. Never combine retinoids with other strong actives initially. Using retinoids with benzoyl peroxide, salicylic acid, or chemical exfoliants on the same evening will cause severe irritation. Once your skin is adapted to retinoids alone, typically after 8 to 12 weeks, you might carefully introduce another active on different evenings. Eventually, some people successfully combine retinoids with other treatments, but build up to this gradually. Vitamin C and other antioxidants can be used with retinoids. Apply vitamin C in the morning and retinoids at night, or apply them on different days. Niacinamide can be used with retinoids in most cases, but some people find them together irritating initially. SPF 30+ broad-spectrum sunscreen is absolutely mandatory every single day when using retinoids, even if you don't plan to go outside. Window glass blocks most UVB rays but not UVA rays, meaning significant sun damage can occur even indoors. Reapply sunscreen every 2 hours if you'll be in the sun. Wear protective clothing, hats, and sunglasses when possible. The combination of retinoid use and sun exposure can cause severe reactions and permanent skin damage. As your skin adapts to retinoids over 8 to 12 weeks, gradually increase usage frequency. After tolerating 2 to 3 times weekly for 4 weeks, increase to 3 to 4 times weekly. After another 4 weeks, increase to 5 to 6 times weekly. Eventually, many people use retinoids nightly. This gradual progression minimizes irritation and maximizes adaptation. If you experience severe irritation, excessive peeling, or significant discomfort at any point, reduce back to a lower frequency. There's no rush. Building retinoid tolerance over several months is perfectly acceptable. Consistency matters far more than speed. Someone using retinol 2 to 3 times weekly for years will see better results than someone who uses it daily for 2 months then stops. Results from retinoid use appear gradually but are remarkable. After 4 weeks, you might notice smoother texture and reduced comedones. After 8 weeks, reduced acne and early signs of improved skin tone. After 12 weeks, significant acne improvement, smoother texture, and visibly improved skin. After 6 months, improved fine lines, more even skin tone, and dramatically clearer skin. After 1 to 2 years, comprehensive skin improvement including acne prevention, minimal fine lines, even skin tone, and visibly healthier, more resilient skin. Prescription retinoids like tretinoin work faster than over-the-counter retinol. Starting tretinoin at 0.025% and increasing gradually can show acne improvement within 6 to 8 weeks rather than 12 weeks. However, prescription retinoids cause more significant initial irritation, making the starting process more challenging. Many dermatologists recommend beginning with over-the-counter retinol to build tolerance, then switching to prescription retinoids if additional strength is needed. Retinoids are teratogenic, meaning they can cause birth defects if used during pregnancy. Women of childbearing age should use reliable contraception when using retinoids and should discontinue use if planning pregnancy or if pregnancy is suspected. Men can use retinoids without this concern. Common mistakes with retinoids include starting with too high a concentration, using them too frequently initially, applying to damp skin, using them with too many other actives, or discontinuing them during the retinization phase. Starting right requires patience and conservative progression. The reward for proper retinoid use is clear, youthful, healthy skin that continues improving even after years of use. Guide 7: Hormonal Acne in Women, Causes, Recognition, and Comprehensive Medical Management. Hormonal acne is a distinct type of acne that affects many women and some men, following predictable patterns related to hormonal fluctuations. Understanding hormonal acne's unique characteristics and treatment approaches is essential for women struggling with acne that doesn't respond adequately to standard topical treatments. Hormonal acne typically appears as deep, cystic lesions, often concentrated around the jawline, chin, and lower face. These lesions are painful, tender to the touch, and located deep within the skin rather than on the surface. They're often described as having no head, meaning they don't develop the white or yellow center that surface pimples have. They can persist for weeks. Most retinization symptoms peak at weeks 2 to 4 and resolve by weeks 6 to 8. However, expecting this phase mentally prepares you to persist through it rather than discontinuing retinoids prematurely. Managing retinization involves strategic moisturizing. The sandwich method, applying retinoid, waiting 20 minutes, applying moisturizer, waiting a few minutes, then applying another thin moisturizer layer, significantly reduces retinization severity while maintaining efficacy. As your skin adapts over 8 to 12 weeks, you can gradually stop using the sandwich method, eventually applying retinoid directly to dry skin. Buffering retinoid strength temporarily by mixing it with moisturizer reduces irritation without substantially compromising effectiveness. Some experienced retinoid users eventually apply retinoids directly to skin for maximum strength, while others continue using the sandwich method indefinitely because it works well for them. There's no wrong approach. Use whatever maintains your skin health while providing desired results. Niacinamide effectively reduces retinoid irritation. Using niacinamide serum in the morning and retinoid at night doesn't provide the irritation-reducing effect. However, some evidence suggests applying niacinamide before retinoid, allowing niacinamide to dry, then applying retinoid on top, might reduce irritation slightly. This is controversial, with some experts suggesting niacinamide interferes with retinoid efficacy, while others dispute this. For most people, using niacinamide and retinoid at different times is the safest approach. Ceramide-rich moisturizers particularly well support retinoid use by maintaining barrier health during treatment. Using moisturizers specifically formulated with ceramides, cholesterol, and fatty acids alongside retinoids helps prevent excessive dryness and irritation. Combining retinoids with other actives requires careful sequencing. Retinoids should not be combined with AHAs, BHAs, or vitamin C initially. After 12+ weeks of stable retinoid use, you might carefully introduce another active on different nights. Many experienced users successfully use retinoid nightly and salicylic acid or benzoyl peroxide on alternate mornings, but this requires well-adapted skin. Retinoid stability matters for effectiveness. Retinol degrades with light and air exposure. Products in opaque, airtight packaging remain stable longer than those in clear or non-airtight packaging. Storing retinoid products in cool, dark places preserves stability. Retinoids become less effective as they degrade, so proper storage extends product effectiveness and lifespan. Retinoid pulse dosing, using retinoids intensively for periods, then taking breaks, is a strategy some dermatologists recommend. The theory is that continuous daily use might cause adaptation, reduced effectiveness, while pulsing maintains efficacy. However, most retinoid experts recommend continuous daily use for consistent results. Occasional breaks for barrier repair are reasonable, but pulsing isn't necessary for maintaining retinoid effectiveness long-term. Combination retinoid protocols use multiple retinoids simultaneously for enhanced benefit. For example, using low-concentration tretinoin at night combined with retinol in the morning. However, this advanced approach requires very well-adapted skin and should only be attempted under professional guidance. It increases irritation risk and isn't necessary for most people. Pregnancy and retinoid use requires special consideration. Retinoids are teratogenic and should not be used during pregnancy. Women of childbearing potential using isotretinoin must use reliable contraception. Tretinoin used during pregnancy is controversial. Some studies suggest it's safe at prescribed topical doses where systemic absorption is minimal, while others recommend avoiding it. Discuss retinoid use with your obstetrician if planning pregnancy or pregnant. Adapting retinoid use seasonally may be beneficial. In winter, when skin is naturally drier, you might reduce retinoid frequency or concentration, or increase moisturizing support. In summer, if your skin tolerates it, you might increase retinoid frequency for more aggressive treatment. Signs of excessive retinoid use include severe dryness, persistent redness beyond the initial retinization phase, barrier compromise, or contact dermatitis. If you experience these, reduce frequency or concentration. There's no badge of honor for using the highest concentration or frequency if your skin is suffering. Optimal retinoid use maintains healthy skin while providing acne and anti-aging benefits. Guide 34. Sleep Quality and Acne, Mechanisms, Optimization Strategies, and Sleep-Specific Skincare. Sleep profoundly affects acne through multiple physiological mechanisms. Understanding sleep acne connections and implementing sleep optimization and sleep-specific skincare significantly improves acne. During sleep, your body undergoes restorative processes crucial for skin health. Growth hormone peaks during deep sleep, supporting skin repair and collagen production. Cortisol, the stress hormone, declines during sleep, reducing inflammation. Immune function is enhanced during sleep, supporting the body's ability to fight infection-causing bacteria. Cellular turnover occurs during sleep, with dead skin cells being replaced by new ones. All these processes directly support clear, healthy skin. Poor sleep disrupts these beneficial processes. Insufficient sleep, less than 7 hours nightly, increases cortisol, promotes inflammation, impairs immune function, and disrupts cellular turnover. The result is worsened acne within days of poor sleep. Many people notice acne worsening after only 1 or 2 nights of insufficient sleep, demonstrating sleep's direct acne effects. Sleep timing matters as much as sleep duration. Your body has a circadian rhythm, an internal clock regulating hormone release and physiological processes. Disrupted circadian rhythm, from shift work, irregular sleep schedules, or jet lag, worsens acne even if total sleep duration is adequate. Maintaining consistent sleep schedules, going to bed and waking up at the same times daily, optimizes circadian rhythm function and supports skin health. Sleep quality matters beyond duration. Fragmented sleep with frequent awakenings, even if total sleep time is adequate, compromises skin health. Poor sleep quality is associated with worse acne. Improving sleep quality requires addressing sleep disruptions through sleep hygiene optimization. Sleep position might influence acne through mechanical and bacterial mechanisms. Sleeping on your back avoids facial contact with pillows and your hands, reducing friction acne and bacterial transfer to your face. Sleeping on your side or stomach involves prolonged face pillow contact, increasing friction and bacterial exposure. However, changing sleep position is difficult if you're not accustomed to it. If you naturally sleep on your side or stomach, prioritize other acne management strategies rather than forcing an uncomfortable sleep position change. Pillowcase cleanliness significantly impacts acne. Dirty pillowcases accumulate bacteria, oil, and dead skin cells, all of which transfer to your face during sleep. Some dermatologists recommend changing pillowcases every 2 to 3 days for acne-prone individuals. Alternatively, sleeping on a clean towel over your pillowcase and changing the towel daily is effective and economical. Some people with severe acne benefit from silk or satin pillowcases, which create less friction and accumulate less bacteria than cotton. Bedroom temperature affects sleep quality. Warmer rooms increase perspiration, creating a moist environment promoting bacterial growth and acne. A cooler bedroom, around 65 to 68 degrees Fahrenheit or 18 to 20 degrees Celsius, supports better sleep and reduces nighttime sweating. If your bedroom is too warm, using a fan or air conditioning improves both sleep quality and acne through multiple mechanisms. Humidity in the bedroom affects skin and sleep. Excessively dry air, from heating systems or dry climate, irritates skin and disrupts sleep. Excessively humid air promotes bacterial growth and acne. Moderate humidity, 30 to 50%, is optimal. Using a humidifier in dry climates or a dehumidifier in humid climates optimizes sleep environment and supports skin health. Light exposure, particularly blue light from screens, suppresses melatonin production, disrupting sleep timing and quality. Using devices before bed worsens sleep through this mechanism. Stopping screen use 30 to 60 minutes before bed improves sleep quality. Using blue light filters on devices if evening screen use is unavoidable provides some protection. Action can also cause micro tears in your skin barrier, leading to increased sensitivity and irritation. For these reasons, dermatologists typically recommend avoiding physical scrubs if you have acne. Chemical exfoliation is gentler and more effective. There are two main types of chemical exfoliants, alpha-hydroxy acids, AHAs, and beta-hydroxy acids, BHAs. AHAs, including glycolic acid and lactic acid, are water-soluble and work on the skin's surface. They're excellent for general exfoliation, improving texture, and reducing the appearance of fine lines. However, they don't penetrate into oil-filled pores effectively. BHAs, particularly salicylic acid, are oil-soluble and can penetrate into sebum-filled pores, making them ideal for acne-prone skin. Salicylic acid dissolves the sebum and dead skin cell plug within the follicle, directly preventing and treating comedones. For acne-prone skin, exfoliating 2 to 3 times weekly with salicylic acid is generally appropriate. Some people with very resilient skin can tolerate daily use, while those with sensitive skin may do better with once or twice weekly exfoliation. Begin conservatively with 2 to 3 times weekly, observing how your skin responds over 2 to 3 weeks before increasing frequency. Exfoliation products come in various formats. Exfoliating cleansers contain salicylic acid and are used during your regular cleansing routine. These are gentle and convenient for daily use. Exfoliating toners are applied after cleansing and before other treatments. They're typically stronger than cleansers and are meant to be left on the skin. Exfoliating serums and treatments are the most concentrated forms and are usually applied 2 to 3 times weekly. Exfoliating masks are meant to be applied for a specific duration, usually 10 to 15 minutes, then rinsed off. When starting exfoliation, begin with a lower concentration of salicylic acid, typically 0.5% to 1%, and gradually work up to 2% as your skin builds tolerance. Many beginners make the mistake of jumping to high concentrations, causing excessive irritation, dryness, and peeling. This leads them to conclude that exfoliation doesn't work for them when the actual problem was starting too strong. The exfoliation process requires proper technique. Apply your exfoliating product to clean, completely dry skin. Applying to damp skin increases irritation and reduces effectiveness. Use your fingertips to apply the product gently, spreading it evenly across your face, paying special attention to areas where acne is most prevalent. Some exfoliating products are meant to be left on overnight, while others are rinsed off after a specific duration. Follow product instructions carefully. During the initial exfoliation period, expect some adjustment. Your skin may experience mild redness, slight dryness, or mild peeling. This is normal and typically subsides within 1 to 2 weeks as your skin adapts. However, if you experience severe irritation, excessive peeling, or significant discomfort, reduce your exfoliation frequency or concentration. Listen to your skin, it will tell you what it needs. Never combine multiple exfoliating products on the same day, and especially avoid combining exfoliants with other strong actives like retinoids or benzoyl peroxide on the same night initially. This overexfoliation damages your skin barrier, causes excessive irritation, and can actually worsen acne. Once your skin is accustomed to each product individually, you can sometimes combine them, but do so cautiously and only if your skin tolerates it well. Some people experience purging when they begin exfoliation, where acne temporarily worsens as the exfoliant brings impurities to the skin's surface. This is generally a positive sign that the product is working, and it usually subsides within 1 to 2 weeks. However, if purging lasts longer than 2 to 3 weeks or becomes unbearable, discontinue the product and consult a dermatologist. After exfoliating, your skin barrier is compromised and needs careful management. Moisturize generously with a product suitable for your skin type. Avoid other potentially irritating ingredients like vitamin C, niacinamide in high concentrations, or peptides on exfoliation days. Stick to basic cleanse, exfoliate, and moisturize. Use sunscreen religiously, as exfoliated skin is more susceptible to UV damage. Seasonal variations affect exfoliation needs. During winter, when skin is naturally drier, you may need to reduce exfoliation frequency. During summer, when skin is oilier and more resilient, you might tolerate more frequent exfoliation. Listen to your skin and adjust accordingly. Results from regular exfoliation appear gradually. After 4 weeks of consistent exfoliation with salicylic acid, you should notice smoother texture, fewer comedones, and generally improved skin clarity. Acne lesions should appear flatter and less inflamed. However, exfoliation is most effective as part of a comprehensive acne treatment plan, not as a standalone solution. Guide 4: Salicylic Acid, the Science, Concentrations, and Complete Application Guide. Salicylic acid has been a cornerstone of acne treatment for decades, and understanding its mechanism and proper use is essential for anyone dealing with acne. Salicylic acid is a beta-hydroxy acid, BHA, meaning it's oil-soluble. This oil solubility is what makes it particularly effective for acne-prone skin. It can penetrate into oil-filled pores where other water-soluble ingredients cannot reach. Salicylic acid works through multiple mechanisms. First, it acts as a keratolytic, meaning it helps dissolve the protein bonds between dead skin cells, promoting cell shedding. Inside the follicle, it dissolves the sebum and dead skin cell mixture that forms cum-dun plugs. Second, it has mild antibacterial properties, helping reduce bacterial colonization within blocked pores. Third, it has anti-inflammatory effects, reducing the redness and irritation associated with acne lesions. Fourth, it can stimulate cellular turnover, promoting healthier skin overall. Salicylic acid comes in various concentrations, typically ranging from 0.5% to 2%. The concentration directly correlates with effectiveness and also with irritation potential. A 0.5% solution is very gentle, making it suitable for sensitive skin or those new to salicylic acid. A 1% solution is considered standard for most people with acne-prone skin, providing a good balance between effectiveness and tolerability. A 2% solution is the maximum recommended concentration for at-home use, offering significant exfoliating power but requiring experienced use to avoid over-irritation. Professional-grade salicylic acid can be applied at concentrations up to 20 to 30% during chemical peels, but these are only performed in clinical settings and are significantly stronger than over-the-counter products. Salicylic acid products come in numerous formats, each with advantages and disadvantages. Cleansers containing 0.5 to 2% salicylic acid are the gentlest form. You use them daily during your regular cleansing routine, and the short contact time limits irritation while still providing exfoliating benefits. Cleansers are ideal for maintaining clear skin and for beginners new to salicylic acid. Toners or liquid exfoliants contain higher concentrations and are left on the skin, providing more potent exfoliation than cleansers. These are typically applied after cleansing and before other treatments, 2 to 3 times weekly. They provide more dramatic exfoliation than cleansers but also carry more irritation risk. Serums and treatments are concentrated salicylic.
Hello and welcome. Take a deep breath with me. In through your nose, out through your mouth. Let any tension dissolve as we settle into this peaceful space together. Today we're going to explore something fundamental, understanding your own skin. Your skin is unique to you. No one else has skin exactly like yours, with its particular combination of characteristics, needs, and behaviors. Understanding your skin type and specific concerns is the foundation of effective skincare. When you truly know your skin, you can choose products and treatments that actually work rather than following trends that might not serve you. Let's start by clarifying an important distinction: skin type versus skin concerns. Your skin type is your skin's natural baseline condition. It's relatively stable and doesn't change much over time. Skin concerns, on the other hand, are specific issues that can come and go, that can be addressed and improved with targeted care. First, let's explore the main skin types. Remember, very few people have just one pure skin type. Most of us are somewhere on a spectrum or have combination characteristics. That's completely normal. Normal skin is the baseline we compare everything to. If you have normal skin, you're fortunate. It means your skin is balanced, not too oily, not too dry. It feels comfortable throughout the day. Your pores are relatively small. You rarely experience breakouts or excessive dryness. Your skin tolerates most products well without becoming irritated. If this describes you, your main goal is maintenance, protecting your skin and keeping it balanced. And dry skin feels tight, especially after cleansing. It may look dull or flaky. Fine lines might be more visible because your skin lacks adequate moisture and oil. Your skin might feel uncomfortable, even itchy at times. In cold or dry weather, these symptoms often worsen. Dry skin needs rich, nourishing products that provide both hydration and oils to seal in moisture. Your skin's barrier function may be compromised, so strengthening and protecting it is essential. Oily skin produces excess sebum, giving your face a shiny appearance, especially in your T-zone, your forehead, nose, and chin. Your pores are typically more visible, and you're more prone to blackheads and breakouts. You might feel like your face needs washing multiple times a day. However, oily skin has advantages. It tends to age more slowly because the extra oil provides natural protection and moisture. The key is managing oil production without stripping your skin, which would only trigger more oil production. Combination skin is exactly what it sounds like, a combination of oily and dry. Typically, your T-zone is oily while your cheeks are normal to dry. This is actually one of the most common skin types. The challenge is addressing different needs in different areas. You might need lighter products for your T-zone and richer products for your cheeks, or you might find a balanced product that works well everywhere. Sensitive skin isn't actually a skin type in the traditional sense, but it's an important category. If you have sensitive skin, it means your skin reacts easily to products, environmental factors, or ingredients. You might experience redness, burning, stinging, or itching when using certain products. Your skin might be reactive to temperature changes, stress, or certain foods. Sensitive skin requires gentle, minimal ingredient products and careful patch testing of anything new. Now, how do you determine your skin type? Here's a simple test you can do at home. Cleanse your face gently with a mild cleanser. Pat dry and don't apply any products. Wait 1 hour, then examine your skin carefully. If your skin feels tight and looks dull, you have dry skin. If you see shine across your entire face, you have oily skin. If you see shine only in your T-zone while your cheeks feel comfortable, you have combination skin. If your skin feels comfortable all over without tightness or excessive shine, you have normal skin. This test isn't perfect, but it gives you a good starting point for understanding your skin's baseline behavior. Now let's move to skin concerns. These are specific issues that might affect any skin type. You can have oily skin with hyperpigmentation, or dry skin with acne, or any combination. Understanding your concerns helps you choose targeted treatments. Acne is a concern, not a skin type. While it's more common with oily skin, people with any skin type can experience breakouts. Acne requires targeted treatment with ingredients like salicylic acid, benzoyl peroxide, or retinoids, combined with gentle, non-comedogenic base products appropriate for your skin type. Hyperpigmentation refers to dark spots or patches on your skin. These can result from sun damage, acne scars, melasma, or inflammation. Ingredients like vitamin C, niacinamide, alpha-hydroxy acids, and retinoids can help fade hyperpigmentation over time. But the most crucial step is diligent sun protection. Without SPF, hyperpigmentation will continue to darken and new spots will form. Dehydration is different from dryness. Dry skin lacks oil while dehydrated skin lacks water. Any skin type, even oily skin, can be dehydrated. Dehydrated skin feels tight, looks dull, and fine lines may be more visible. The solution is hydrating products with humectants like hyaluronic acid, along with adequate water intake, and avoiding harsh products that strip moisture. Redness and rosacea fall on a spectrum from occasional flushing to persistent redness to the visible blood vessels and bumps of rosacea. Triggers can include temperature extremes, spicy foods, alcohol, stress, and certain skincare ingredients. Gentle products, barrier repair ingredients, and avoiding triggers are key. Sunscreen is essential as sun exposure can worsen redness. Large pores are a common concern, especially with oily skin. Pore size is largely genetic, and you cannot actually shrink pores permanently. However, you can minimize their appearance by keeping them clear with regular exfoliation and by keeping your skin well hydrated, which plumps the skin and makes pores less noticeable. Fine lines and wrinkles become more apparent as we age. Prevention through sun protection is most effective, but retinoids, peptides, and good hydration can improve their appearance over time. Texture concerns include roughness, bumps, or uneven skin. Regular gentle exfoliation, retinoids, and proper hydration can significantly improve texture over several weeks to months. Now, here's where understanding gets practical. Once you know your skin type and concerns, you can build a routine that addresses both. If you have dry skin with hyperpigmentation, you need rich, hydrating base products plus targeted brightening treatments. Your cleanser should be creamy and gentle. Your moisturizer should be rich. Your treatment products might include vitamin C serum and perhaps a gentle retinoid at night. And sunscreen is absolutely essential every day. If you have oily skin with acne, you need lightweight, oil-free products that won't clog your pores, plus acne-fighting ingredients. Your cleanser might contain salicylic acid. Your moisturizer should be gel-based or very light. Your treatment products might include benzoyl peroxide or retinoids. You still need moisturizer and sunscreen. Oily skin needs these too. If you have combination skin with sensitivity, you need balanced products that don't trigger reactions. Gentle, fragrance-free formulas are essential. You might use slightly different products on different areas of your face if needed. The key is addressing your skin type with your base routine, your cleanser, moisturizer, and sunscreen, and addressing your specific concerns with targeted treatments layered in appropriately. Your skin will also change with seasons, hormones, stress levels, and age. The oily skin you had in summer might become combination in winter. The dry skin you have now might become more normal once you establish a good routine. Stay attentive to these changes and adjust accordingly. Pay attention to how your skin feels and looks throughout the day. Does it feel tight an hour after cleansing? Your cleanser might be too harsh. Is your face shiny within a few hours of moisturizing? You might need a lighter product. Does your skin sting when you apply certain products? You might be sensitive to specific ingredients. Your skin is constantly communicating with you. Listen to it. Trust its signals. If something burns, stings excessively, or causes redness, your skin is telling you it doesn't like that product. Honor that message. Keep a simple log if it helps. Note which products you're using and how your skin responds over days and weeks. This can help you identify what works and what doesn't, especially when you're trying new products. When trying new products, introduce them one at a time. Wait at least a week, ideally 2, before adding another new product. This way, if you have a reaction, you'll know exactly what caused it. If you start 3 new products at once and break out, you won't know which one was the culprit. Patch testing is wise for anyone, but especially if you have sensitive skin or have had reactions before. Apply a small amount of the new product to a discrete area, behind your ear or on your inner arm, and wait 24 to 48 hours to see if you react. If all is well, you can try it on your face. Remember, expensive doesn't mean better for your skin. A drugstore moisturizer might work perfectly for you, while a luxury serum might cause irritation. Your skin doesn't know or care about brand names or price tags. It only knows what works and what doesn't. Similarly, natural doesn't automatically mean better or safer. Some natural ingredients are wonderful for skin. Others can be irritating. Some synthetic ingredients are gentle and effective. Judge products by how they perform for your skin, not by marketing claims about natural versus synthetic. As we come to the close of our time together, remember this: understanding your skin is an ongoing process, not a one-time assessment.